Whenever we went to a restaurant, I had to sit with my back to a wall. I had to be able to see the exit. If that wasn't possible, I would panic and leave. Everywhere felt dangerous. Once I started treatment for PTSD, my psychiatrist prescribed medicine that really helped. It took the edge off the anxiety so I could work on my therapy.
The nightmares were rough. I had a lot of trouble sleeping. I kept seeing the same horrible image. While I was doing cognitive processing therapy with my psychologist, my family doctor prescribed an antidepressant. It helped me quiet my mind so I could sleep, and I was less agitated, irritable, and depressed when therapy was hard. It helped me focus and move forward.
These are the voices of people who have lived through a trauma and developed symptoms of post-traumatic stress disorder, or PTSD, and who have found medication to be a useful part of their treatment. PTSD affects the way people think, act, and interact with others. It can cause great distress. But there is good news. PTSD is treatable. There are several cognitive behavioral therapies which are proven to help people process the trauma, including CPT, PE, and EMDR. Each therapy helps people to change unhelpful thoughts and behaviors that are related to the traumatic experience, and people can get their lives back. In some cases, medication is used in combination with these treatments. Antidepressants, known as selective serotonin reuptake inhibitors, or SSRIs, affect chemicals in the area of the brain known to affect thinking and reduce anxiety and depression. For many people struggling with PTSD, these medications can help reduce the thoughts that feel stuck, like when someone thinks, "No place is safe," or "I can't handle this." The medications can also reduce some of the irritability, sadness, agitation, and fear that might make treatment difficult. There are other medications sometimes used to help with sleep, nightmares, or other physical symptoms. Those medications may help people feel more comfortable, but they don't directly treat the diagnosis of PTSD. Regardless, it is always critical to have a conversation with your medical provider about how each medication works and what you should expect of it. Evidence-based therapies like CPT, PE, or EMDR are the most effective treatments for addressing and alleviating the overall condition. PTSD is a serious condition that affects some people who have lived through something traumatic. It impacts people's thoughts, actions, relationships, hope for the future, and self-image. But with the help of an evidence-based therapy in combination with an SSRI medication, PTSD doesn't have to last forever. People go on to live happy, peaceful, fulfilling lives, and the future looks hopeful again.